The causes of shoulder replacement surgery, or what leads a patient to need that particular procedure, are several-fold. Probably the most common cause is underlying shoulder osteoarthritis. There are different types of arthritis. The main type is where the ball and socket just wears over time as one ages. A different type of arthritis is rheumatoid arthritis. Often can be heritable, and it's a different type of process that involves the lining of the joint, the synovium, that is inflamed, and it can lead to joint degeneration as time goes on. And so those are the two main types. Injuries of a joint can cause a problem later in one's life, so post-traumatic osteoarthritis. So, if you were to have, let's say, a shoulder dislocation or multiple dislocations at a young age, it can predispose you to having a problem later on.